would be some of the core principles that you learnt in your time in that clinic? And, is a biopsychosocial approach, the pain contingent versus quota-based exercise prescription for people with pain? How would you go about helping someone with chronic long-standing back pain?
So I use a more biopsychosocial approach, yeah, where there's a lot of factors involved. It can be stress, family issues, there's genetics involved, there's cultural issues involved. They have a fear, they lack confidence, concerns, and it's not all just about the pathology, because more often than not, the pathology is not the important thing. Someone can have a disc bulge, the same sort of disc bulge as another client, and have no pain, because that client with a disc bulge can have a lot of pain, and you've got to figure out why is that, what's going on for them. It's more like guiding them, client, into finding the confidence that they can do things, that they're not going to cripple, that they're not an invalid, and there are gentle things they can start doing and getting themselves back.
Progressively easing them back into resistance training or strength training or
exercise. Yes, and it's always, I always come back to resistance training, and there's a lot of myths out there with low back pain. A lot of myths, that you always have to have your spine in neutral, and that's a myth. The spine's an extremely robust part of the body, and it's made to bend and extend. It's made to do it, and it's all about loading. And if you know your loading principles, you can pretty much do most things. Yeah, it's all this gentle, progressive loading, and having plateaus and being consolidating and moving on. Another thing, there's a lot of myths about posture, or you hear a lot of people coming in, my pelvis is rotated this way, I've got this upslip this way. And if you have a look at the evidence, not a lot of it is true. There's a lot of myths and beliefs that the pelvis rotates about 3 degrees, 3 to 5 degrees. It's a very sturdy part of the body, which is pretty much the center of your body, and so many forces have to go through it that if it rotated the way people say it doesn't so easily, you'd all be on the ground. So it's just trying to dispel gently a lot of the myths that are out there and saying, look, it is good to lift. It is good to get stronger. Deadlifts, squats, hip thrusts, RDLs, Jeffersons, they're not your enemy. They are, in fact, going to be your friend.
So as we go through today, Andre, we're going to talk a little bit about some of the different injuries that some athletes might experience during rugby league as well, some of the more common injuries. And also what I want to do for the listeners is provide some actionable strategies to prevent these injuries, but also some actionable strategies to manage these injuries as well. So in terms of back pain, for the listeners, what are some actionable things they can do to help prevent back pain occurring, but in the instance that they do have long-standing chronic back pain, to manage the pain, whether it be heat or cold treatment, as we talked about, progressive resistance training? What would you recommend?
So that's a very broad question, and it all depends on the client and the and their condition. So, but basically, classic is don't stay in one position for too long. Gentle movements are good. Don't always rush to get a scan. Be patient. Surgery is your absolute last option. My thing is, do whatever you want to do that makes you feel comfortable in the first instance. A lot of people ask, well, how should I sleep? Do I need to sleep in this position? End of the day, you just need to get sleep. A lot of people have disturbed sleep, and then it leads into a downward spiral. Lack of sleep, depression, pain, and you just spiral downhill. So my advice is get good sleep no matter how you get it. If that you need to take some pharmaceuticals, take the pharmaceuticals, whether it's anti-inflammatories or painkillers or muscle relaxants, take some. You need to sleep. You can use heat or cold. That's up to you. I don't mind, whatever you do. Seek some good advice. Don't Google. Try not to Google too much. Avoid getting a scan straight away, because scans can be misleading. Sometimes what you see on a scan can be totally asymptomatic, but then people see stuff on the scan or have stuff reported on the scan, and you start going down rabbit holes, chasing these things that aren't really your issue. Okay? So the idea is to just gently get moving. It's understandable that you're in pain and you're in a bit of fear. Realize that you're not alone in this. A lot of people have gone through a lot of these pains themselves and come out very well. They're out the other side and gone back to a very normal life.
So that's great in terms of preventative strategies.
So preventative strategy, so I didn't talk about it. Preventative strategy is being active and strength training of some sort. Be strong. They've shown, studies have shown that, yes, you can do your yoga and your flexibility and your stretching, but they do not decrease the risk of injury. It might make you reach further or make you more mobile, but to help with prevention and prehab, strength training. And when we look at that, we look at mainly the posterior chain group of muscles. They're the group of muscles that, if you believe in evolution, got us up from being on all four to upright. So we're talking about your hamstrings, your glutes, erector spinae, all the big muscles. And other people say, well, I didn't do enough core. I didn't enough core. Core, where you sit or you lie on your back and you gently focus on just contracting a small group of muscles very carefully and trying to get it really accurately, is not as helpful as doing this posterior chain. And what you try and do with the client is get them to recruit their core or turn on their core while they're doing the exercise, or while they do a hip thrust, or while they do a hamstring bridge, or whatever. You get them to incorporate their core into those exercises, and it's way more functional.
So say you have someone who's a manual laborer, say, I don't know, gardener or whatever it may be, they're getting pain in sustained lumbar flexion where they're bent over, crouch posture. What would be your first point of call there?
Right. So say they came into me and we're trying to figure out what it was, and it may well be a disc injury. So let's say, first 24, 48, 72 hours, there'll be some muscle spasm, there'll be pain. So might settle that down, get them to do some gentle basic movements, and that might be just, they can use heat, they can use anti-inflammatories for pharmaceuticals. I'd maybe get them doing some just lying on their back, simply just knees side to side, just rolling side to side, And it would start saying, well, maybe you can see if you can do an extension push-up or lie prone with a pillow underneath you. I'd say sit with a lumbar roll in the small of your back. It's always helpful. Clients find that a lot, even when you're sitting in the car or sitting down, because a lot of them have difficulty getting up from a sitting position to a standing position. So sit to stand. And that's where the lumbar spine goes from flexion to extension, and they're having trouble getting into that extension moment. So he's trying to encourage some more extension.
Right. So like those non-provocative planes of movement that don't.
Correct. Yeah. Correct. Gentle movements first.
So when it comes to back pain management, one of the philosophies which I've kind of touched on before you sort of addressed a lot of those preventative and actionable steps that you talked about there was the pain contingent versus quota-based approach to pain management. And I guess that all comes back to monitoring training volume and load, doesn't it?
Yeah, it does. I mean, you hear it's being knowledgeable into cycling your load. Not every training session you have to go max or to failure. And, the classic scenarios, you work out your 1 RM, and then the first week you train at 60%, second week 7%, third, fourth, to 90%, and then you drop back a week and have a really light deloading week, and then you progressively go up sort of like that. It's also listening to your body to a certain extent. If you feel tired, you don't have to push that extra lift. It's okay to cut it back. It's even okay to have days off from the gym, sort of thing. But it's about being educated, and I think I saw a study the other day somewhere where people are found that you could get maximum benefit from 3 to 5 sets. And past that, you don't really get any benefits. If people are doing 6, 8, 10 sets, no point. But you're just overloading.
Does that apply to German volume training, where you see that people are doing, one exercise, 10 sets of, say, bench press or squat?
Yeah, that would apply. I haven't seen a lot of that. In fact, I don't know anyone who really does that anymore. But I've heard people do it. They do it for brief stints, and I think they just get bored of it, or else they get an injury.
You tend to hear a lot when people are talking about their pain. Say you have a roofer, as I talked about, a gardener, or someone who's a manual laborer, and one day they are okay, their pain is manageable. Say they have a week or two of leave from work, and their pain exacerbates, and vice versa. So maybe they have a lot of work and they're really busy, and their pain exacerbates. What would be your kind of guidance for individuals in this circumstance, or any professionals that might be listening to this podcast that are suffering from that pain in
But
that way described there?
so, what are you saying? They're working for a couple of weeks, and then they have a week off, and then their pain exacerbates with the week off.
So basically, they've got more load on certain weeks, and then other weeks they have less load. The volume of work they're getting through is varied from week to week, and they can start to notice, trends in terms of when they're starting to experience more pain, more or less pain, or experiencing flare ups.
Yep. So it's those guys, say the gardeners or the landscapers or the bricklayers, concreters. Listen, they're very intensive on the back, those bending positions and stuff like that. Generally, these guys have a long work history and they're pretty resilient to it all. However, you've got to remember a lot of back conditions are genetic. So one guy does one load, the same build, will get through it, and another guy, similar build, similar workload, may not get through it. Simply based because of the genetic history that they have. What I say to them is that they should be doing some sort of back strengthening work, even though you say, well, I work my back all day, but no, you're not doing the right sort of loading. That means going to the gym in a couple of mornings. Signal to be, or they should take breaks away, or if they're starting to feel that way, they need to take some more breaks, just break it up during the day, little short intervals, or palm some if they can, work off to the younger guys, younger apprentices. Generally, it's not the young guys who are feeling it, it's the older guys who've got the longer history. So pull back a little bit if you can.